Stick with us for this next session. I think it's really important as we start to get a little bit more of a level down now and understand a bit more of the detail. And we really want to start to understand a little bit more about where there are great examples of how we can perhaps understand much more about young people. So this connecting the right young person into the right intervention is critical. If we're going to put that child first with experiences and understanding of trauma and that sort of stuff, how best can sport position itself to understand where young people are coming from, what's going on for young people? And so to help guide us through this for the next 20-25 minutes, we're going to welcome a showcase of an example from Greater Manchester, from work that the Violence Reduction Unit are involved in there. And to help us understand it, I'd like to welcome Inspector Paul Nolan from Greater Manchester Police. Good morning, Paul. Good to see you, bud.
Morning, everyone, and first and foremost, welcome to my study. Right, I'm going to try and share my screen. If this goes in the right way, we'll laugh it. I think that's going to work. Right, so welcome. I'm going to speak for about 20 minutes, then I'm going to hand over to Dr. Caron Walpole, and we're going to look at place, people, priorities. We're going to look at taking some of the themes that we've discussed today through all the inputs, which have all been really quite impressive, so no pressure on me to follow. But what we're going to do is we're going to look at a Manchester-based process. It doesn't have to be a Manchester-based process. I'm hoping as you listen to this particular presentation, you're going to pick out bits that you think, I can see that working in my organisation and I can see that working in our communities. Before I start, and I'll go through a formal introduction, I've got something for you. And what I want you to do through this presentation is really think about where you sit within this process. So yes, this is Manchester-based. Yes, this is through the VRU, the Violence Reduction Unit. And it's going to discuss something called PIDE. And for those who want to know, PIDE stands for Prosecution or Prevention, Intervention, Education and Diversion. But what it really does is it kind of highlights that we don't have a remit. And that becomes clear as we go through the process to why there is no remit and why we have no threshold. So we discuss all children that are named as suspects in crime. So where do you sit in this process? Can you identify whereabouts in this particular program that we run, where you would say how you can influence your own particular group of adolescents in your cohort? So who am I and why should you listen to me? Well, you don't have to listen to me, but I am here for the next 19 minutes or so. So I'm Paul Nolan, I'm a police officer. I've been a police officer for over 20 years now within Greater Manchester Police. And I suppose within that context, and this is not to talk about war stories, but my career has been very tactical, very operational. So for large amounts of my career, I've sat within specialist operation teams. So riot cops, people that can do rapid entries into houses. I've run overt and covert intelligence teams. And prior to the VRU, my role was in a proactive burglary team. And there's two things I was particularly good at. One, putting teams together that were very driven. But secondly, finding offenders and putting those offenders into prison. And that was offender management for me. However, in 2019, I started to evolve. And I suppose really this goes back to you can teach an old dog new tricks. And I know you're all saying it doesn't look that old, but I am. So in 2019, joined the Violence Reduction Unit. And what we started to do and what I started to do then is think about how I managed offenders. And some of those offenders will have been adolescents over the 20 years. And actually, going to the VRU approach, this public health approach, looking at the causes of crime, looking at the causes of the causes, actually it started to open up some new doors in terms of how we think. And what I started to do is look around the prevalence of crime in adolescents, albeit the VRU look at everyone from 0 to 25, and actually start to think about how Greater Manchester Police treated adolescents involved in crime. Where were the hurdles? How could we be better? And that then led me on to creating the PIDE program. So, see if technology is working for me. So in its simplest forms, what does it aim to do? So it aims to identify risk and look for opportunities to help. So what does risk mean? Well, risk is about harm. Risk is about the harm to victims. as you will know in your organisations, and certainly we're aware of, harm can move between suspects and victim. Our adolescents are not only suspects, they're not only victims, there is a crossover. And we've got to be open now to adverse childhood experiences. You'll hear me talk about adverse childhood experiences, toxic stress, and it's about looking at those risks wider than we've ever done before. It also looks for the opportunities to help. So how do we take those young people, give them a voice, and allow those young people to tell us what they need to be successful in the areas that they live? It works on collaboration. This is not something you can arrest your way out of. It's something that needs collaboration with statutory agencies. So we look at early help, youth justice, youth services. We look at commission charities that can provide inputs and interventions around substance use. We look for your organisations that provide interventions as well. Also backed up with coaching and mentoring. It looks to mitigate risk by understanding causes. Again, that goes back to adverse childhood experiences. And it looks to prevent offending. And that's key, because albeit this process sits within criminal justice, it could, and it was initially designed to sit in education. Unfortunately, because of the pandemic, we had to move. So schools closed down. And what we found is that criminal justice in the criminal justice world has a constant supply of victims and suspects. So we might see a decrease in offending in robbery on the streets, but we'll still see domestic abuse. So this model sits within criminal justice. However, you can replace criminal justice for education, community group. You can replace that strand with a whole host of other people, and you will sit within that framework as well. So the next slide I'm going to show you is what I give to officers. So some of the stuff that I do in the VRU is around informing officers what trauma responsive policing is. And this slide just talks about ACEs, and it's about Manchester. And as I talk on, feel free to scan across the different subjects. And one of the things that we wanted to get across is when Greater Manchester Police historically have dealt with an event, are we dealing with demand? Is it what's in front of us? Or are we taking the extra 5 minutes to sit down with our young people, our suspects and our victims, and open up conversations around these particular subjects? So whether it's neglect or abuse, physical, emotional, sexual, whether it's household dysfunction. And what we always tell officers is these are considered to be the 10 taboo ACEs. So these are the things that we won't openly discuss in groups of our friends, but it's not the only thing that can be an ACE. Bullying would sit on the adverse childhood experiences, as would bereavement. And this process is about understanding that. It's about treating that criminal event as what it is. It's an event. It's the end of a thing. But actually, before that thing was the child at home living with some of these ACEs. So actually, by addressing those ACEs, we've more chance to prevent offending, with more chance to prevent reoffending if the offending's already taken place. So there's some bubbles with some big numbers. What does this all mean? Well, this process started with a bit of research, and what I did between December 2019 and 2020 is start to look at all the crimes that were recorded in Greater Manchester where we had a named suspect. And that's key. So what it won't include is a robbery where 4 people are suspected of committing the offence, but there's no people attached to it. There's no names. These are all linked to a person and all have a named person. So remember when I said we look at a cohort that's under 25, on the right-hand side, that's the 18 to 25 cohort. On the left-hand side is the under 18s. The under 18s will inevitably become the over 18s at some point. So the way that we look at that, if we can prevent offending within that younger cohort, it will lead to a prevention of offending later on. But just to give you some ideas of demand. So 4,264 crimes recorded with children named as suspects. That's 14.5% of our demand. When we move that across to the 18 to 25s, it increases 6,320, which is almost 20% of our demand. Collectively, that cohort is creating 33, nearly 34% of our demand. It's massive. It's a massive area of coming into the police. And the next slide really kind of looks at what we did with it. So there's various bits of text on there, and some of it won't make any difference, but I've left it on because it does build in context. What we're going to look at is the colour system that's linked to it. So the text, just to cover that so you know, within any investigation within Greater Manchester Police and throughout the UK, when an investigation comes to a conclusion, it is given a disposal code, and there's rules and guidance around that. What we see here is when we review all of those 4,000 crimes, what we see is that predominantly crimes are being closed, suspects identified, does not support, and there's reasons for that and valid reasons for that. But there's other clumps there, and I've coloured those red. And the reason I've coloured them red is when we do the deep dives on these crimes, when we actually look at the investigation and then what happens after closure, what we find is that there's very limited, if any, referrals through to early help, youth justice, charities that can provide that trusted adult relationship that will start to build and work with children around those adverse childhood experiences, which inevitably meant 2019 to 20, we were very much demand driven. We were looking at criminal events as a single entity. So for example, if a young person committed a shoplifting, that's what we were interested in. So in our world, it will be considered a low-level offence, and that's because of a gravity matrix scoring rather than the moral aspects of committing a crime. But ultimately, what we were doing is asking the shop, do you want to prosecute? The chances were, no, we don't. We would then write on the crime investigation, something along the lines of, this is a child offender, we don't want to criminalise the child, it's not in the public interest, and then we would finalise the matter. What we weren't doing is looking at that child and saying, right, it is a theft, it's a shoplifting, but why? Why has this happened? Is there a history of domestic violence? Is there a history of substance abuse in the family? Is there anything else on our complete computer systems that tries to identify something more than just a shoplifting? And ultimately we weren't, which is why we took this research to the Greater Manchester Combined Authority, took it to the Police and Crime Commissioner, Baroness Beverly Hughes, and we put forward the idea that GMP were recording crime. We had various disposal codes, which you can see on the screen, but ultimately we were missing 73% of our children were missing an opportunity to be referred into some form of organisation that could support them better than the police could. Statutory-wise, that sat with youth justice groups, it sat with early help, but within that is education, within that is health, within that are community groups that support our communities and our young people. So what could we do in Greater Manchester that moved this to make those kids, so if you imagine the ones that are in red are invisible to your organisation and others, how do we move them into the green? And when we look through the other codes, the 14% that are amber, we've not spoken to those children yet. They've been named as a suspect in crime, but we've not spoken to them, so they're ambers. The 13% that are green are the ones that naturally lead into youth justice, so cautions, charges, diversionary work that's been recognised officially. So how do we increase that 13%? So that's where the PIDE process comes in, the PIDE programs. What it aims to do, and I'll show you a flow chart a little bit later, but what it aims to do is on a daily basis look for children that have been named as a suspect in crime. That doesn't attach any guilt whatsoever on that young person. All it does is it forms a starting point. We then use PoliceWorks, which is our operational system, to look for adverse child experiences. We look for history of domestic abuse, vulnerability, missings. We look through the whole operational system. We try and build some antecedents. We try and build a better picture. What we then do is we share that information with our key stakeholders. So early help, youth justice, teachers and education, the youth justice nurses that sit within schools. We share it with our community groups, and there's some commission charities that sit on our group as well. We ask them for information as well. Do you work with this child? Do you know this child? What's the voice of the child? What is it that they're telling you that they need to be successful? And ultimately, what that leads to is a very quick meeting. It's only 1 hour a week, but we have a discussion around the table, and it's far too soon to talk about interventions, but we talk around the table about who's best placed to introduce themselves to the family, because that's key as well. This is not just about the child. Sometimes it's about the family as well. But who's best placed to introduce themselves as an agency to say, what is it that you need to be successful? Have that conversation around constructing that positive social norm. Have that conversation around capturing the voice of the child. And then that leads to an intervention where coaching, managing those toxic stresses is really valuable to prevent offending and reoffending. So that's how the PIDE program works. Ultimately, what does it look like? Very similar pie chart. This is taken from Berry, which is one of my pilot areas. Some of you may be going, all he's done is colour the slide, Tim. What you will actually see is there is a slight change in some of the figures in terms of the outcomes. Now, this is key because initially when we looked at this process, we looked at GMP as if they were doing something wrong. We looked at opportunities of changing, for example, an outcome 16, the suspect, the victim doesn't support. We change that into something else that looked more positive. But in actual fact, if for the right reasons the victim doesn't want to support, then they don't need to. What the PIDE program does is it acknowledges that. But what it also does is it makes that child visible to those agencies that, because of the nature of the event, because of the low-level nature of the event, may not hit the threshold for children's services and other statutory agencies to get involved if we're just looking at the shoplifting. And actually what this process is means of bringing this to our statutory partners and commission charities and organisations like yourself to say, what is it that you can do for this child in the place where they live to do something that they want to do? What is it that they need? Now, in terms of flow chart, for those who like flow charts, this is the PIDE program broken down. So if anything else, just look that there's 4 lanes. The data in this case comes from the police. So we'll refer to police data warehouse, which is Cognos, our operational system. And as you can imagine from the policing system, there's a whole host of information that we can get hold of. From your point of view, that could be a conversation. Your organisation will have its own data, and that might sit within conversations you have with your children. GMP's in the middle there, so the PIDE officer who sits and builds the antecedents and shares it and chairs the meetings. And the Youth Justice PC, because we prompt that professional curiosity as well, all sit within there. But that could change to education. That could be a teacher, a pastoral team. It could be a community group. So think about that as we go through. How do you fit within that? Child and the family is central to this. This is about consent in most cases. This is about children that are being prosecuted. This is about a family that we're going to approach and try and get through some of the stigmatisms around accepting help, knowing that you need help, having those honest conversations about what is it that you need. And then the key stakeholders. So how do you feed back into those referral mechanisms that exist and have existed for years? How do you refer your young people through to early help, the prevention side of youth justice? How do you link in with a social worker and a key worker? Those processes are already there in terms of early help referrals through, usually early help referral hub with your community at the side will take you through a website for referrals. What we then do is close the loop. We feed that back. So that feeds back into our data. So we acknowledge that albeit the child's not being prosecuted, we have provided a referral to an organisation to build that trusted adult relationship around toxic stress and start to help build those positive aspirations and the positive outcomes that come next. This next slide I've added in because what I'm hoping is it shows, and I know Mark Ellison's on the line from Manchester Metropolitan as well. What I'm hoping is it shows that this is not just a good idea. Well, it is a good idea, but it's not just my idea that sits in my head and everyone thinks, well, that sounded really convincing, Paul. We'll all go and put that in place. We're actually doing an evaluation, an academic evaluation of the process that takes the data from youth justice, takes the data from the police and the process itself. We've interviewed key stakeholders. We've asked what they feel are the hurdles and the positives. We're looking at the outcomes, and that will lead to an evaluation product. Mark, no pressure, but summer of this year, that's going to be finalised and done. So far, what does it kind of look like? And these figures are a little bit old, if I was honest. They're probably 2 or 3 months out of date, so these figures have increased. I've chosen Tameside and Bury. They are our pilot sites. We have control of Tameside and Bury. In Tameside, it predominantly sits with youth justice. They are commissioned to do prevention work as well as statutory work. In Bury, it sits predominantly with early help. Youth justice are only commissioned to do the out of court work and the statutory work at the end. But as you can see, if we think about that movement between invisible child to visible, and what does that look like? In Tameside, we've discussed 274 children. Out of that 274, some of those, 45%, will have key workers already, social workers. These are children that are known in the criminal justice world and children's services. So we close that loop. We inform the social worker. We ask the social worker, what do you need to support you in your plan around the child? 105 children offered specific diversion work that were invisible before. In Bury, slightly more numbers, not because criminally it's a busier place. They were up and running just a little bit longer than Tameside. But they've discussed more. 549 children have been discussed. 298 of those have been referred through again. And again, in Bury, we closed the link. We informed the social worker. We were finding that on low-level events, social workers weren't being told. We're reaching out, and I know Caron Bailey is also on the call, and she's done some amazing work over at Bury. We reach out to the social worker, the key worker. This is not a safeguarding meeting. We acknowledge that the plan around the child is theirs, and we ask the question through the VR funding, how can we assist you in your journey to increase aspirations and so on? So that's the PINE process. That's the PINE program broken down. Hopefully it makes sense. Hopefully you've identified where you sit in that. And I'll hand over to Caron. Caron?
Okay, thank you very much, Paul. Yes, so just thinking about referral processes, I'm very conscious that it's 11 o'clock and it's break time, but I'm just going to talk just a little bit about the referral processes, because I think Paul highlighted the advantages of having a formal referral process in place, because as you know, for you as sport practitioners, it helps to give you information about that young person. It helps you to make sure that you're giving them the right intervention, the right level of support and expertise. But not everybody has a formal referral process in their area that they're able to hook into. So I suppose that some of the thoughts have to be, you know, are you able to find existing referral routes that you can hook into to try to get that level of contact with services already working with young people? Because there's lots of advantages to that. But if you're not, and we know from having done research in this area, that our projects, where we have quite a lot of sports projects, where they have informal referrals or self-referrals for young people. And these have shown to be quite handy, actually quite useful, for exactly what Paul was talking about, those invisible young people. Because there are still young people who are invisible, who are not known to any agency, but you know, they've certainly got serious issues going on in their lives and in the community. So thinking about informal and self-referrals, I think they're important to consider, because one of the things which is an advantage of that is that if young people are referred informally to you as an LTO into sport, then they want to do it voluntarily. And if they do it as a self-referral or within your own project, you recognise somebody needs some extra help, they want to do it voluntarily. And the concept of a young person doing an intervention voluntarily is very important. If a young person is compelled to do it and doesn't want it, it will very likely be unsuccessful. So voluntary, we know, is really important. And if you're doing it informally and self-referrals, then you have to be very careful with your safeguarding, because you don't know what's going on in that young person's life. You need to think about the level of support that young person needs to make sure that what your sport project is offering them is going to be appropriate and relevant. And also that the staff working with them on a face-to-face basis, so your coaches, your mentors, the other volunteers, have the training and expertise to work with them. Because as Paul was saying, we have quite a lot of young people with different levels of ACEs. We have, a significant number of young people in deprived areas with those vulnerabilities. And your staff might well be faced with disclosures of abuse, and they need to be able to deal with that perfectly in exactly the right way at that very first point of disclosure, and then know what to do with it afterwards. Not just in a safeguarding point of view, but also to make sure that they get enough support. So ideally, formal referral systems are the best place for sport, because you get all the support, like Paul was describing. There's a holistic package in place, lots of partners already there for the young person. But if you don't do that, and you have informal and self-referrals into your projects for young people in this context, then I think there are lots of things that you need to think about before you start this work. You need to really support young people and your staff. So those are the main points that I would bring out at this moment in time. And I hope that's been helpful, and I'll hand back over to Graham.
Thanks very much, Dr. Caron Walpole there from Loughborough University, a long-time academic partner of StreetGames. And Caron will be popping back in to end each of our sessions and just draw some of that learning together.